of the worldwide population, especially Americans. There are about 200,000 Americans a year that get diagnosed with lung cancer. It's very important to diagnose and start to treat lung cancer early. The earlier that we diagnose and start to treat lung cancer, the more lives that we can save.
Did you know that lung cancer is the second most common cancer worldwide, yet over 60% of cases are diagnosed at an advanced stage? But here's what most people aren't paying attention to. Lung cancer often starts with common symptoms that are easy to ignore. Every year, thousands of people delay seeking help for early warning signs, frequently leading to late-stage diagnosis and reduced chances of survival. According to the Lung Cancer Epidemiology, Etiology, and Prevention, the 5-year survival rate for localized lung cancer is 52%, but it drops to just 4% when cancer spreads to distant organs. Even more important is that early detection can dramatically improve survival chances, yet many people overlook the signals their body sends. In the next few minutes, I'm going to share with you 6 early warning signs of lung cancer that could save your life or the life of someone you love. These are not only the obvious symptoms like extreme chest pain or coughing blood you've likely already heard about. They are the elusive and unexpected signals your lungs send before the disease progresses further. Most people ignore or dismiss these signs as minor health issues, but recognizing them early can make all the difference. And let me be clear, this is not just another list of vague health concerns. We'll be focusing on warning signs supported by research studies that have already helped countless individuals detect lung cancer early. So, stay tuned, because these signs are not to creep you up, but just to empower you with the knowledge to take action and seek help early. As per research, the incidence of lung cancer, and therefore its related mortality, can be reduced by early detection, treatment of disease, chemoprevention, and smoking avoidance and cessation.
So this is why it's important to do lung screening. The definition of screening is that we're taking somebody who doesn't have symptoms, but they're at high risk, and we're checking to see if they have potentially an early detectable cancer that is not symptomatic, but yet can be cured.
By the end of this video, you'll have the tools to recognize these warning signs and potentially save lives. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions about your health or a medical condition. Do not disregard professional advice or delay seeking it because of something you have read here. Now, let's dive in. 1. Persistent cough that doesn't go away. One of the most overlooked signs of lung cancer is a persistent cough that lingers for weeks or months. Unlike a temporary cough caused by a cold or allergies, a cancer-related cough typically doesn't improve with time or over-the-counter remedies. Instead, it often becomes worse, deeper, or more frequent. This occurs because tumors in the lungs irritate the airways or block normal airflow, leading to chronic irritation. Over time, this constant irritation can cause changes in the cough, such as a harsher tone or the presence of mucus tinged with blood. A study published in the European Respiratory Journal revealed that persistent cough is one of the most common symptoms of lung cancer, with over 65% of patients reporting it as an early symptom. So remember, if you notice a cough that persists for more than 3 weeks, especially if it's accompanied by other symptoms like fatigue or shortness of breath, it's crucial to consult a healthcare provider immediately. Early intervention can help diagnose the underlying cause, and if it's cancer, treatment can begin at a stage where outcomes can be significantly better. 2. Unexplained shortness of breath. Shortness of breath that occurs unexpectedly and without a clear cause can also be one of the most commonly overlooked symptoms of lung cancer. Unlike the breathlessness that comes with physical exertion or asthma, cancer-related shortness of breath tends to appear gradually and intensifies over time. A study published in 2023 suggested that the most common symptom in all lung cancers, dyspnea, is one of the most unpleasant. So, what is the reason for this shortness of breath? When a tumor obstructs the lungs or causes fluid buildup around the lungs, leading to reduced lung capacity and difficulty breathing. Simple activities like walking or climbing stairs may leave you feeling winded or gasping for air. If you experience shortness of breath without a clear cause, or if it's combined with other symptoms like a persistent cough or chest pain, seek medical attention as soon as possible. Early intervention and testing can identify any underlying issues and significantly increase the chances of successful treatment, particularly when lung cancer is diagnosed in its earlier stages. Before we move on, if you are looking to dive deeper into the early indicators of cancer, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you reduce weight and feel your best delivered right to your inbox. 3. Sudden, unexplained weight loss. A sudden and unexplained drop in weight is often an overlooked yet critical warning sign of lung cancer. Unlike weight loss, which occurs due to intentional dietary changes or exercise, cancer-induced weight loss is a result of the body's metabolic disruption caused by the disease. As the tumor grows, it releases substances that break down fat and muscle, leading to rapid and unexplained weight loss. This can also be accompanied by loss of appetite, nausea, or digestive changes. Weight loss without any clear cause can be alarming, especially when combined with other symptoms such as persistent fatigue, coughing, or chest pain. It may indicate that the body is under stress, and in the case of cancer, it could signal advanced disease. Research studies also suggest that unintentional weight loss could be an early symptom of cancer. Suppose you notice a sudden and significant weight loss, typically more than 5% of your body weight within a few months, without making any lifestyle changes. In that case, it's important to consult a healthcare provider. Early detection is key, as it greatly enhances the chances of successful treatment and survival. 4. Coughing up blood. Coughing up blood or rust-colored phlegm is one of the more alarming yet often overlooked signs of lung cancer. Research also suggests that coughing up blood is a critical warning sign that can improve lung cancer survival rates if detected early.
Lung screening, low-dose CT scan every year so we can catch this early nodule at a point where we can say we can cure it, rather than wait until you now have weight loss and coughing up blood and all the other symptoms that are associated with late cancer, at which point cure is probably not going to happen.
Unlike the occasional blood-tinged mucus from throat irritation or cold, persistent, or noticeable blood in the sputum warrants serious concern. This can happen when small blood vessels in the lungs rupture due to pressure from a growing tumor. Blood in the mucus may appear in streaks or larger amounts, and often mixes with thick, discolored phlegm. When tumors in the lungs cause blood vessel damage or lead to infection, they result in coughing up blood. Even a small amount should never be ignored, as it may indicate that the cancer has progressed to a stage where it's affecting lung tissue directly. If you notice blood in your cough or phlegm, whether it's a small streak or more noticeable bleeding, it's essential to see a doctor immediately. Early diagnosis of lung cancer can dramatically improve survival outcomes, so don't overlook this potentially life-saving warning sign. 5. Chest pain. That worsens with coughing chest pain, that worsens when you cough or take a deep breath, is often one of the most overlooked signs of lung cancer. Unlike the temporary discomfort that might result from muscle strain or respiratory infections, cancer-related chest pain is more persistent and can become progressively sharper or more intense. This pain is typically described as pressure or a stabbing sensation, especially when you try to breathe deeply or cough. As the tumor grows, it may press against the chest wall, ribs, or surrounding organs, leading to irritation of the tissues. The tumor may also invade the pleura, the lining of the lungs, which results in more severe pain that becomes noticeable with deep breaths or coughing. They can often invade nearby nerves, including the brachial plexus. This can lead to pain radiating to the shoulders, arms, or upper back. Lying down or specific movements can aggravate discomfort, especially if the tumor compresses nearby structures. If you experience chest pain that is severe or lasts longer than expected, and it's associated with symptoms like coughing or shortness of breath, it's crucial to consult a doctor. This pain could indicate that the cancer has spread or advanced, and early detection is essential for more effective treatment and a better chance of recovery. 6. Hoarseness or changes in your voice. Hoarseness or changes in the voice is another symptom of lung cancer that often goes unnoticed. Unlike the temporary voice changes caused by a cold or sore throat, hoarseness related to lung cancer tends to persist and doesn't improve with typical remedies such as throat lozenges or cough syrup. This happens because the tumor affects the vocal cords or irritates the recurrent laryngeal nerve, which controls the voice. This causes paralysis or dysfunction of the vocal cords on one side and the voice to become raspy or strained, making it difficult to speak clearly. In addition to hoarseness, in some cases, you might notice a weak or soft voice or a sensation of lumping in your throat. Inflammatory responses from the tumor can also irritate the nerve or surrounding tissues, causing pain during speaking. If you experience persistent hoarseness that lasts for weeks or worsens over time, it's important to seek medical attention. Although hoarseness can be caused by benign conditions like acid reflux when combined with other symptoms, it could signal a more serious issue, such as lung cancer. Early intervention improves the chances of effective treatment and better long-term outcomes.